Which of the following biomarkers is most commonly used to assess brain injury after cardiac surgery with cardiopulmonary bypass? A. Creatine kinase, CK. B. Brain natriuretic peptide, BNP. C. S100B protein. D. C-reactive protein, CRP. Answer: C. S100B protein. Explanation: S100B protein is a biomarker that is commonly used to assess brain injury following cardiac surgery with cardiopulmonary bypass. Elevated levels of this protein indicate neuronal damage, and it is often used in conjunction with other tests to evaluate cerebral morbidity. Creatine kinase, CK, is more relevant to myocardial injury, while BNP is related to heart failure, and CRP indicates systemic inflammation. What is the most significant factor influencing the risk of stroke in patients with preoperative atrial fibrillation undergoing cardiac surgery with CPB? A. Preoperative use of anticoagulants. B. The presence of a mechanical heart valve. C. Duration of atrial fibrillation. D. Increased left atrial size. Answer: D. Increased left atrial size. Explanation: An increased left atrial size is a significant factor influencing the risk of stroke in patients with preoperative atrial fibrillation undergoing cardiac surgery. The enlarged atrium can lead to the formation of thrombus, which can embolize and cause stroke. While anticoagulants and mechanical heart valves can play a role, left atrial dilation is one of the most important risk factors. Which of the following techniques is recommended to reduce the risk of cerebral embolism during cardiac surgery with CPB? A. Pulsatile perfusion. B. Use of alpha-adrenergic blockers. C. Administration of high-dose corticosteroids. D. Mild hypothermia during CPB. Answer: A. Pulsatile perfusion. Explanation: Pulsatile perfusion has been shown to reduce the risk of cerebral embolism during cardiopulmonary bypass by improving cerebral blood flow and reducing the formation of embolic particles. Mild hypothermia and corticosteroids may have benefits for protecting the brain but do not directly address embolic risk as pulsatile perfusion does. Alpha-adrenergic blockers are not typically used for this purpose. Which of the following is a primary mechanism by which cardiopulmonary bypass, CPB, can lead to cerebral ischemia during cardiac surgery? A. Decreased cerebral blood flow. B. Increased intracranial pressure. C. Direct injury to the brain tissue. D. Increased cerebral venous pressure. Answer: A. Decreased cerebral blood flow. Explanation: Cerebral ischemia during cardiac surgery with CPB primarily occurs due to decreased cerebral blood flow. This can result from a variety of factors, including low systemic perfusion pressure, impaired autoregulation of cerebral blood flow during CPB, or embolic events. Increased intracranial pressure and direct injury are less common causes. What is the primary role of the intraoperative transcranial Doppler, TCD, during cardiac surgery involving CPB? A. Monitoring brain oxygenation. B. Detecting cerebral embolism. C. Assessing brain temperature. D. Evaluating postoperative cognitive function. Answer: B. Detecting cerebral embolism. Explanation: Intraoperative transcranial Doppler, TCD, is primarily used to detect cerebral embolism during cardiac surgery with CPB. TCD can identify the presence of microemboli, which is important for real-time monitoring and for taking preventive action to reduce the risk of stroke. It does not directly monitor brain oxygenation, temperature, or postoperative cognitive function. Which of the following strategies has been shown to reduce the incidence of postoperative cognitive dysfunction, POCD, after cardiac surgery with CPB? A. Prolonged use of anticoagulants. B. Low-dose sedatives during recovery. C. Early postoperative mobilization and cognitive rehabilitation. D. Increased oxygen delivery during CPB. Answer: C. Early postoperative mobilization and cognitive rehabilitation. Explanation: Early postoperative mobilization and cognitive rehabilitation have been shown to reduce the incidence of postoperative cognitive dysfunction, POCD. While increased oxygen delivery during CPB and the use of sedatives may have some benefit, they are less directly related to preventing or managing POCD. Postoperative rehabilitation, including cognitive exercises, is one of the most effective approaches to minimizing long-term cognitive dysfunction. Which of the following changes during cardiopulmonary bypass is most likely to contribute to cerebral edema? A. Use of high-flow CPB. B. Hypothermia. C. Hypercapnia. D. Hypotension. Answer: C. Hypercapnia. Explanation: hypercapnia, elevated carbon dioxide levels, during cardiopulmonary bypass can contribute to cerebral edema by causing vasodilation in the brain, leading to increased cerebral blood volume and pressure. This can promote the development of edema in vulnerable brain tissue. Hypothermia and hypotension are generally neuroprotective, while high-flow CPB may not directly contribute to cerebral edema. Which of the following is the most appropriate intervention to reduce the risk of brain injury during the weaning phase from cardiopulmonary bypass? A. Maintain a high hematocrit. B. Reduce the rate of weaning from CPB. C. Administer vasopressors to increase blood pressure. D. Allow for a rapid return to normal circulation. Answer: B. Reduce the rate of weaning from CPB. Explanation: reducing the rate of weaning from cardiopulmonary bypass is an important strategy to reduce the risk of brain injury. Slow weaning allows the cerebral circulation to gradually adjust to the return of normal cardiac function, helping to maintain stable cerebral perfusion. Sudden changes in flow or pressure can lead to cerebral hypoperfusion or embolic events. Which of the following is a potential long-term complication following a cerebral ischemic event during cardiac surgery? A. Chronic fatigue syndrome. B. Increased risk of deep vein thrombosis. C. Persistent memory impairment. D. Elevated blood pressure. Answer: C. Persistent memory impairment. Explanation: a cerebral ischemic event during cardiac surgery can lead to long-term complications such as persistent memory impairment and other cognitive deficits. This is often seen in patients who develop postoperative cognitive dysfunction, POCD, or experience a stroke. Chronic fatigue syndrome and deep vein thrombosis are less commonly associated, and while blood pressure may fluctuate, it is not a direct long-term consequence of cerebral ischemia. Which of the following is the most reliable predictor of cognitive dysfunction after cardiac surgery? A. Duration of surgery. B. Preoperative cognitive status. C. Use of cardiopulmonary bypass. D. Age of the patient. Answer: B. Preoperative cognitive status. Explanation: preoperative cognitive status is one of the most reliable predictors of cognitive dysfunction after cardiac surgery. Patients with pre-existing cognitive impairment are at a higher risk for developing postoperative cognitive dysfunction, POCD. Other factors, including the duration of surgery, use of CPB, and patient age, also contribute, but preoperative cognitive function remains the strongest predictor.